Jennifer Snyder, on behalf of the California Association of Health Facilities. They're saying I can come up to the podium, so I'll do that.
Okay.
Is that okay? You want me to walk?
No, you can say, I just didn't want it to, the two
Just don't
mics
touch
to like,
the podium.
right, exactly,
Okay.
to have the, I didn't want them to mate or something.
Yes. So first, I want to say on behalf of the California Association of Health Facilities that we're very encouraged by the governor's proposal. We are also very encouraged to hear the different points and issues that the Department of Public Health talked about today related to how they're trying to address the audit report and also their internal compliance report that they have been handling. We have, over the years, and Gary Passmore was very eloquent at this, we have been part of numerous discussions here in the legislature and have sponsored and supported many bills trying to attempt to address the issue of backlog of complaints. For health facilities in particular, it's very frustrating for them to have a complaint opened within 24 days or 10 days, have a surveyor come into their building, start the process, and then not see anybody for a year, not know how to resolve the complaint, not know how to address it, and then a new person comes in a year later and asks for all the same information that we started with a year before that. We know of many times where it's 3 to 4 years before a complaint investigation is completed, and let me say I have heard that these are the investigations being completed is also a problem, not just citations being issued. That we actually need to get that investigation completed, not just a citation. We don't even know if we've gotten to a point where a citation is warranted after 2 to 3 years. So this has been a process, an ongoing process, and obviously frustrating for the facilities themselves. It is my understanding that almost half of the backlog is incidents that are required to be reported by facilities themselves. So especially long-term care facilities, nursing facilities are required to report unusual occurrences. And those are not clearly defined, at least in state law. So depending on the area and depending on the facility, they can report everything from residents getting the flu to a possible small fire in the kitchen to a real incident where there could be abuse between an employee and a patient or between a resident and a resident. So it runs the gamut. So you see numerous facility incident reports that are part of that backlog. And facilities themselves have to go through a whole internal investigation process. They have to decide how they're going to address that, and they have to go through a whole plan of correction to address that. So they would really like to have that parallel approach that happens with the department in conjunction, not 2 or 3 years later. Mm-hmm. So we're encouraged. We would actually urge the committee as part of the subcommittee, as part of determining how you go about approving or agreeing to the funds that have been appropriated or proposed by the governor, to also look at ways that we can have measurable goals. And the 3 most important from the California Association of Health Facilities perspective is 1, timely completion of investigations, some measurable goal to get to a certain timeline where those can be completed. 2, to have consistency in surveyors. If one surveyor starts that investigation, that surveyor should complete that investigation. And then, you know, at the very least, there should be accountability for those completions, and there should be goals that they must meet based on these new funds. But again, we're encouraged by the governor's attention to this, and we really urge the committee to take that and go forward with it. And we'd love to be helpful in any way we can to make that happen. Thank you.
Thank you. Next witness, please.
Hello, my name is Karen Jones. I'm with the Long-Term Care Ombudsman Program in San Luis Obispo County. I'm also a member of our State Ombudsman Association, CalCOA. And I'm here today, I agree with all the comments on public health, and I am very grateful that there is an effort to make improvements. I've done this for over 16 years, so I've also seen a lot of history. Still not the 30 years, but I've been here a while. The comments about the Ombudsman Program that were in the agenda, particularly the part on page 41, where it mentioned that there's kind of no actual hard data about the cost savings of the Ombudsman Program to the state of California, is true. It's very hard to say, because I didn't buy a new car, we don't have a car payment, right, you know. Right. But I wanted to point out to you that just this week, on Tuesday, my office had gotten a phone call from a family member the Friday before asking if we could attend a meeting with them at a care facility in San Luis Obispo County. I was able to coordinate with the volunteer assigned to that facility, and we were able to go to that meeting with the facility staff and the family. The issue was that the elderly husband, father, has dementia. And his dementia is pretty advanced, and he's not reacting well to changes in the facility and how some of the staff are treating him. We were able, because of our involvement in that meeting, to stop an eviction process, which would have taken a very long time for the licensing agency to get involved in. In fact, the facility is at the far northern reaches of San Luis County. It's serviced by the Department of Public Health in Oxnard. It would have been at least 3 hours one way of driving for licensing to have gone out, plus all the time investigating. There was at least, in my count, over 10 complaints that we were dealing with, involving how the staff were treating him, verbal evictions. If it had gone to a written eviction process, it would have also involved Department of Healthcare Services, which would have had to have somebody come down from Sacramento to hear the appeal. So that's a full day of travel, plus overnight, plus the appeal process. It was a massive savings to the state of California, and we were not only able to resolve it in less than 2 hours of my time and a volunteer's time, just a little bit of mileage reimbursement, we were able to keep that resident in our county. One of the facilities at the care facility the gentleman lives in now was recommended to him is a facility, they felt he needed a dementia care facility, which was probably true, but we don't have any in our county, was a facility that was so bad it was actually decertified last year. And that's where they wanted this family member to take him. So there wasn't a lot of compassion about where to send the gentleman. They just wanted him out of their facility. So there really is, we have very good anecdotal evidence that we are saving the state of California a lot of money. That's not my job. My job isn't, as an ombudsman, to save California money.
Right.
But I don't mind making that as a side benefit. You know, we really need the funding. We want to do our job. San Luis County has some different resources than some of the other programs, so we were able to accommodate that request to be at that meeting with just a few days' notice. Not every program could do that. If every ombudsman program was adequately funded, I'm not talking well-funded, I mean give us enough money so we can do our job, we could really make a dent in those complaint numbers going to the licensing agency because they don't need to get to a complaint level. We can stop them before they get there. So I would urge you, when you're ready to vote on these issues, to consider the vote for ombudsman funding and also for our full request, which we definitely need the funding that's been proposed here, which is about $600,000, but we also need about $4 million to really do the full job. And so I thank you for your time.
Thank you. I'm going to ask the witnesses to really try to be concise, stick to the 2-minute timeline. I'm mindful of the hour, and I know I have colleagues that need to travel. Next witness, please. Thank you.
Hi. Thank you for hearing our comments. My name is Becky Mann. I'm the long-term care ombudsman from Monterey County. And I'd like to thank the members for your efforts in dealing with these very complex issues, and also extend my appreciation to the staff for including the long-term care ombudsman recommendation for this funding out of the these accounts to help our program. As you heard from Karen Jones, who preceded me, the ombudsman is a low-cost investment with a huge return. We solve local problems locally wherever possible, often preventing the state regulator from making a visit to the facility. Now, how do we do this? We're in the community. We are 108 staff throughout the state with 856 state-certified volunteers who are in the facilities on a regular basis. We know the residents, we know the staff in the facilities where we are assigned, and we can provide a bridge to mediate these problems that arise, one of which you just heard about. But another aspect of our work in the community is this. We work with law enforcement, the Public Guardian's Office, Adult Protective Services, physicians, bioethics teams, the District Attorney's Office, and others as needed to affect positive outcomes for the residents of these facilities, all at no cost to the state. These working partnerships enable us to reach out quickly to the resources right in the community when dealing with these issues that negatively impact a resident's life, whether they be of a financial, legal, mental health, medical nature, or in another realm. The increased funding from the citations penalty and quality assurance fee accounts will enable us to step up our frequency of visits and complaint resolution, which have been seriously hampered since 2008-9 when our general funds were cut. So I urge you to support this request for the funding, and we will be back at future hearings regarding our general funds request. As you heard from the prior speakers, we are in dire need of that money to really step up with 1,000 Californians turning 65 every day. So thank you for your attention.
Thank you very much. Next witness.
Good afternoon, Madam Chair, committee members, staff. I'm Joe Rodriguez. I'm the California State Long-Term Care Ombudsman. I oversee the operations and activities of the local ombudsman programs throughout the state. I want to thank you and acknowledge your recognition of the work that local ombudsmen do. I think, you know, we do play a role in quality of care and quality of life and improving those things for residents. 20 years ago, the Institute of Medicine, that entity that advises the nation on its health, said that the long-term care ombudsman program serves a vital public purpose. Every year, the long-term care ombudsman program helps many thousands of individual residents, and the program can justly claim to have improved the system of long-term care services. Just last year, ombudsman representatives throughout the state investigated more than 39,000 complaints made by or on behalf of residents of long-term care facilities. Of those 39,600 complaints, ombudsman representatives were able to resolve or partially resolve to the satisfaction of the resident almost 73% of those complaints, 3 out of every 4 complaints. So I want to thank you for your support, for your recommendations, and thank you on behalf of the residents who do need this service, who need this program in their lives and in their homes.
Thank you very much. Appreciate it. Next witness, please.
Thank you, Madam Chair and members. Carol Sewell from the California Commission on Aging. The Commission fully supports the request for the long-term care ombudsman to receive a portion of the citation penalty account funding. As you've heard, this is an essential program. When we know that state investigators can only get to facilities once every 5 years, knowing that these volunteers and professionals are visiting facilities on a monthly basis is essential, and I think it provides a reassurance to people who can't be there every day or every month even. So we really hope you will give strong consideration to this request. Thank you.
Yes, Stone.
Thank you for your testimony, and I'm strongly convinced after hearing testimony today about the benefits of the ombudsman in intervening and hopefully solving problems. So again, the state inspectors don't have to come out. Mr. Leo, is it $1.2 million that's budgeted for the program, statewide ombudsman program?
I'd have to check on that.
Is that what it is?
Perhaps finance can tell you.
How much is budgeted?
Department of Finance, Jerry Metalka. Currently, we have about $522,000, 9 positions in state long-term care ombudsman for state ops.
How many positions?
9 positions.
For the entire state of California?
Well, that's for the state long-term ombudsman state office, but then we also have about, there looks to be about $1.9 million in local assistance.
Okay, so what is the bottom line for the ombudsman? What are they looking for to make sure that we have appropriate ombudsman representation throughout the state of California?
Come on, identify yourself.
I want to cut to the chase because I think what you do is vital, and I want to find out how we fund it appropriately.
My name is Lisa Coleman. I'm the Executive Director for the California Long-Term Care Ombudsman Association. Okay. So we are a membership association representing the 35 local programs. So your question is, how much general fund money is going to the local programs?
Yes.
And that would be none. The money that you have in general funds is going to support the state office. And you heard from Joe Rodriguez earlier, and he does a lot of vital, important projects for the state. But that's not going into facilities and providing advocacy. The $1.9 million, that's coming out of the Quality Assurance Fund. And then we also receive, I believe, 1.1 from the citation account. That's to replace the $3.8 million that was removed from our general funds. But we're still severely inadequately funded. Currently, we receive $3 million from the federal government from Older Americans Act. The Older American Act says that the state is supposed to supplement by 2/3. So we're supposed to get $3 million from the feds, and then we're supposed to have $6 million that comes some manner. Okay, well we're $4 million short. So that's where this is request. We actually have a 3-pronged approach: general funds, citation account, and quality assurance. And if you put all three of those together, we're going to go back to the day where we have a robust ombudsman program.
The general fund support was cut when?
Okay. Thank you. I appreciate that information.
I'd like to just point out a different perspective, though I am incredibly proud of the 73% performance rate, and I will hold that up as a badge of honor. I am proud of the ombudsman work that the programs do. But I would like to point out another service that the ombudsman does besides protecting the vulnerable. What we do is we provide a sense of protection to Californians, because California workers don't have the luxury of being able to go and visit their families on a day-to-day basis to check to make sure that mom is being fed. They don't have the knowledge to know what residents' rights are. They don't have the ability to know where facilities tend to cut corners. That's what the advocates know. I don't need you to spend money to get every Californian aware of what residents' rights are in long-term care facilities. You don't need to if Californians can feel secure that their mom and dad are going to be well cared for, because there are licensing agencies that are holding people, holding administrators accountable, and you have the advocates working in on a day-to-day basis, ensuring best quality outcomes. So thank you for bringing this forward and agendizing it. We look forward to discussing alternate ways in which we can support the department. I think in the past we may have had an adversarial role, and I think that's absolutely wrong. The Ombudsman program needs to be in support of what the Department of Public Health does. It's our job to make your job easier, I believe. So,
Thank you. Next witness, please.
Hi, my name is Nancy O'Keefe, and I'm the interim director for Contra Costa County with Ombudsman Services. I just want to encourage you to give us more money. We work really hard. I'm on call 24 hours a day. I make weekend visits, I make night visits, and I can tell you I recently made a complaint to the licensing agency, and I was told that they don't go out on weekends, and that's where the problems were on the weekends. Very disheartening. So thank you very much.
Thank you very much. Next witness, please.
Rebecca Gonzalez, National Association of Social Workers, California chapter. We're also here in strong support of the Long-Term Care Ombudsman program. It's a program that works and one our seniors vitally need. Thank you.
Thank you. Next witness.
Good afternoon. My name is Elizabeth Arenas. I'm a health facility evaluators in Los Angeles County and a member of SEIU 721. We are encouraged by the state's recognition of LA County's contract is underfunded and the proposal for a partial down payment on the required workload. I feel the daily impact of the program underfunded half of what the state is, and see it in the eyes of the residents we protect. I am, along with my colleagues in the Health Facility Inspection Division, more than an evaluator, more than a state subcontractor. I am an advocate for the frail, vulnerable, and elderly of Los Angeles, an advocate for public safety, an advocate for our community. I have worked in Health Facility Inspection Division for 22 years, and I am not alone in my long tenure. I have many colleagues in Los Angeles County who share the same history as me. With our low turnover rate, long institutional memory, and new leadership, we play an important role protecting the residents in Los Angeles County. Legislator, as you know, LA County has done this work for nearly half a century, since the 1960s. We are best equipped to provide services in our county. And I could give a little history if you like. Under the contract with the state, we are charged with monitoring a network of 2,500 health facilities in Los Angeles County alone. We engage in quality review of surveying, certifying facilities, licensing, relicensing, investigating complaints, red flagging patient safety concern, identifying the bad players, essentially protecting the public from neglect and abuse, and helping to keep our hospitals and health facilities free and outbreak. We do this night, weekends, holidays, unannounced. As you know, chronic underfunding hampers our work. We are encouraging the state to negotiate a fair contract with LA County with incremental funding and staff increases every year of the contract to eventually fund all mandated state and federal workload. We are asking the state for long-term commitment to the welfare and safety of patients, in Los Angeles County Health and Long-Term Care Facility. Thank you.
Thank you very much. Next witness.
Thank you. Michelle Cabrera on behalf of SEIU California, and we are speaking on behalf of the state and county workers who do this work, although I will have a colleague speaking specifically to the state issues. First, I want to thank the chair and especially your staff for your hard work on this issue. Trailer bill from last year helped us to increase the transparency and accountability and oversight on this program. And I also want to thank the chair and the committee for keeping this item open today. First and foremost, this issue is about the public's health and safety. Many of our field staff, particularly from LA, as Elizabeth mentioned, have decades of experience. They know the program, they know the geography, the facilities, and they know the laws. Recently, our workers helped to identify the superbug that was identified at UCLA. And as reported by the Hubbard consultant report, our workers are literally the backbone of the program. But we have put a lot on their shoulders. They are buried under backlogs, and these backlogs are getting worse, and it's due to delays in action. We've known about some of these issues for a long time, and the resolution's been a long time coming. It's true, LA County did bargain for better wages for their workers. They also have about a quarter of the turnover rate that the state has. And so I don't think it's unreasonable to look at the role that wages play in worker recruitment and retention, especially in the nursing field, where outside of public service, wages are far more competitive. And so I think, frankly, this is one of several approaches that the state could take. But again, the 5.8% turnover rate in LA County is something that the county should be proud of. And I will also note that, when the state or the county invests in training someone, it takes up to a year to get them ready to do this work, and we're losing people to the very institutions that they're, learning to survey. So the industry hires them away, and so we need to be mindful of that. Even if we're looking at a more incremental and phased-in approach as suggested in the January budget proposal, we're still about $4.8 million short in LA County to accomplish Tier 1 and Tier 2. So we would hope that the committee, along with CDPH, will reconsider those numbers and look at making sure that LA County can be successful in meeting those goals. We also want to make sure that there is a more robust worker engagement in the proposed reforms. Again, the folks who do this work know this program better than almost anyone else, and so we need to draw on their expertise and make sure that they're tapped to be a part of that change. They're going to be involved in training all the new workers who come in, and when our workers are supported, they ensure that our laws have meaning, that the public is protected. When they're not, our public welfare is at stake. So we're heartened by this initial step by the state, but we want to make sure that there's urgency toward a longer-term solution.
Thank you very much. Next witness, please.
Good afternoon. I'm Selena Pryor-Dansby, representing SEIU Local 1000. I want to echo the comments of the speaker before me, my colleague. I think she did a great job. I just want to say that we think this is the governor's proposal of the 237 positions is a great first step. But what we want to make sure is that these positions are sufficient to address current and future cases and other issues that have left our members completely frustrated. Our members make way less than their counterparts, even in LA County and in the private sector. When we mentioned this to the department, they said it should be done at collective bargaining. Well, we do other things in the state, not at the bargaining table, and so we think this is something that will aid with retention and recruitment, and it's something that should be definitely taken very seriously. We're encouraged by the January budget proposal and the state's efforts to report more through the stakeholder process, but we need to make sure that we still have a long way to go. So we look forward to working with you. Thank you.
Thank you. Next witness.
Good afternoon, Madam Chair, honorable members, and distinguished staff. I'm Bill Barnaby here on behalf of DaVita Healthcare Partners. As indicated by the discussion today, nursing home licensing, inspections, and investigations dominate the staff and resources of licensing and certification. We're here on another issue that we think is important and may even help keep people out of nursing homes. And we're here to support the additional funding for staffing of surveyors, health facility evaluation nurses who do surveys of dialysis clinics. And it's important that these surveys of new clinics take place in a timely fashion. The incidence of end-stage renal disease is continuing, and these folks need dialysis care to stay alive. And so we're hopeful that you will approve the additional staffing so that the department can hire more registered nurses to inspect and survey ESRD facilities, dialysis treatment facilities, because they can't operate even once built until they're licensed by licensing and certification and Medicare certified by licensing and certification. So it's essential to keep that going, and maybe we can keep some of these folks out of nursing homes, keep them treated on an outpatient basis so they can go home or even work and move forward in this. So we urge approval of the additional positions. Thank you very much.
Thank you, sir. Next witness.
Thank you. Michael Arnold, representing the California Dialysis Council. Just reiterating the comments of Mr. Barnaby on behalf of the State Association of Dialysis Clinics. Also to let you know that there's a bit of a ticking time bomb that may be underway in California at this point in time. As you know, we have an epidemic of diabetes and hypertension, more dialysis patients coming online. Two things are causing dialysis companies to think twice before locating facilities in California, and we worry that the number of stations may not be keeping up with the number of dialysis patients over a few years. Those two situations are the fact that a lot of our new facilities have to sit for a few months before they are before they are licensed and certified. Secondly, of course, and we'll talk more about that later, is the very low reimbursement rates under the Medi-Cal program. So anyway, thank you so very much.
Thank you. And final witness on this topic.
Nicole Wortelman on behalf of the Ventura County Board of Supervisors. We're also here in support of the additional funding for the Long-Term Care Ombudsman Program. As you've heard, it's an extremely valuable quality program for our residents.
Thank you very much. Appreciate it. Any comments, wrap-up comments you'd like to make based on public testimony? No. Okay. Thank you very much. Appreciate it. The discussion will continue. We're going to hold these two items open. Next, we'll move on to item number 8 under Department of Public Health, page 46 on the agenda, which is Genetic Disease Screening Program Update and AB 1559 of the 2014 statute.
Oh, good afternoon.
Good afternoon.
My name is Connie Mitchell, and I am the new Deputy Director of the Center for Family Health.
Great.
And I'm going to do a very short overview of our center, and then because I am new, I'm going to turn it over to Leslie Gaffney, who is the Assistant Division Chief over Genetic Disease Screening Program.
Thank you.
Our center is divided into 3 divisions: the Genetic Disease Screening Program, Maternal, Child, and Adolescent Health, and WIC. But we really don't organize ourselves around 3 divisions. We organize ourselves around 3 phases in a woman's life. The time when girls and women would try to maximize their health prior to becoming pregnant through a whole variety of programs. And then if they do become pregnant, we have another set of programs that helps them to achieve their greatest health so that they can go through the pregnancy without any complications. And then once the child is born, we invest a lot of time and energy to get that baby off to a great start. And we do that through all of our programs throughout the center, and then also in coordination with many other programs in the Department of Public Health. We try to coordinate with them and engage them and make sure that we have a comprehensive approach to it. So that's just a quick overview of our Center for Family Health. So today what we're going to be talking to you about is our estimate and our BCP regarding AB 1559 through the Genetic Disease Screening Program. And I'll turn it over to Leslie, who I know will give you just a brief orientation to that and answer your questions.
Thank you.